Hello, everyone, and welcome to yet another Contagion Live broadcast video interview as part of our ongoing COVID-19 coverage. And we're in a very interesting position right now in terms of where we stand in our COVID response and public health actions surrounding it. Obviously, many states in the Northeast region have moved into a phase 2 position of trying to reintroduce businesses to the public and embrace a little bit more leniency in the lifetime. And unfortunately, as a result, we're seeing some spikes and increases both in this region and further out west and in the south in terms of new daily cases and even mortality rates increasing. And the population of COVID patients looks a little bit different today than it did about a month ago. And joining us to talk about it today is Saskia Pescu, who is a member of the Contagion editorial board and is currently stationed in Arizona. And we're going to be talking a little bit about her home state and how things have fared lately. So Saskia, first and foremost, how you doing?
Good. Thanks for having me.
Thank you so much.
Appreciate it.
Yeah. And thank you so much for joining us. We always appreciate your input, your perspective, your writing on these topics. It's excellent to have a friendly expert. And Saskia, I personally have family in Phoenix and, have been a little bit personally tapped into what's going on there. And it's very troubling right now. And it seemed like in the conversations that you and I had prior to this call, you feel very similar. Can you give us a little bit of the lay of the land right now?
Yeah, it's pretty not great. Realistically, the numbers keep getting worse. We're very concerned about that. I think the last number I saw for Friday was over 3,000 new cases reported, which is a record high for Arizona right now. Most of the cases are in Maricopa County, which is where Phoenix is, the biggest city in Arizona. And I think there's just an increasing concern because hospitals are quite busy. They did reopen to elective surgeries on May 1st, and then the stay-at-home orders expired on May 15th. And not surprisingly, Memorial Day weekend happened. A lot of images and videos out there showing really packed restaurants and bars around Phoenix. And then we started to see case counts go really high. So you had this perfect situation where hospitals were getting busier, ramping up on surgeries, and had high census. And then suddenly really rapid growth in cases of COVID-19, which is very concerning, very stressful right now.
Yeah. And, obviously there is some kind of logical explanation to it. Of course, as you were saying, just the leniency behind it and just sort of the natural spread of the virus towards the Midwestern part of our country. Was kind of foretold when it, started to spread more greatly on the coast. But of course, there's also a little bit of it that's concerning to the nature of how we understand it right now. It's speaking anecdotally to research that we've covered on our site showing that, heat reduces the transmissibility, or so we believe, of the virus. You would think, case in point, Arizona would be doing better than it is right now, right? But this kind of shows how influential the entirety of public health response is, right?
Well, I think, the studies regarding heat are definitely important. The environmental components are huge to this, but also really viruses spread through people. So wherever there are people, there's going to be transmission. Certain factors can influence that. But realistically, in Arizona, we opened way too early, way too fast. And especially right now, as you mentioned, heat, where are people going to go when it's 110 degrees outside? We can't tell them to go eat outside, exercise outside, spend more time outside because natural ventilation and space for social distancing. So they're going to be inside wanting to go to restaurants and malls or museums and things like that, which is, understandable. But at the same time, my concern is that we're going to see packed indoor areas that really encourage transmission. And plus you have President Trump's rally coming to Phoenix tomorrow, which is a huge concern, I know, for many Arizonans. So there's a lot of factors at play. There's a lot of concern right now, especially since hospitals are having about 85% capacity in terms of that's how full they are. So there's very little wiggle room and a lot of focus on hospitals as a metric. But I always like to remind people that hospitalizations are a lagging indicator. When we look at hospital capacity, that means we're inching very, very close to that full capacity. And once we hit that, there's not a lot of room to walk it back.